As a mental health professional, I find it very interesting all the conversations that happened about all the data around physical illnesses. Also, I'm kind of loving those sounds of the aircraft going up. I hope there's some child left inside all of us that you still like the sound of an aircraft buzzing over you, right? And probably that's where mental health comes down to. Are you still enjoying your life, or somebody needs to teach you a happiness curriculum to start feeling happy again? And God forbid, in years' time, we'll probably have ministries of happiness and ministries of making you feel good and ministries of this and that, because humankind is refusing to accept that mental health is important. I go before COVID and then I'll come post-COVID. 2019 data for you. 15% of working adults at a given moment in time are having a mental health concern. This is pre-COVID for you. And that's why mental health has been not that one elephant in the room, but this whole herd of elephants that somehow we just don't end up seeing. And we keep talking about all these things. Like I was hearing about diabetes. Let me share one very interesting data coming out from the recent reports. You put cancer, you put diabetes, you put respiratory diseases in one bucket. Now you put mental health in the other bucket. The mental health bucket's impact economically and socially beats these three illnesses put together. That's the elephant in the room. But we don't talk about it. We are okay doing our preventive health checkups. I find the word preventive health checkup such an incomplete, non-scientific con act done by healthcare providers, by industries. If you are not putting, if mental health is not a part of the healthcare checkup, how can you even call it a preventive health checkup? Define health, and it's a dare to anybody here, right, or especially the medical practitioners. Define health without using the word mental health or any component of mental health. You won't be able to do that, right? Then how do you have these preventive health checkups which do not involve mental health? How do you have these employee wellness programs? An employee wellness program is not a workshop on stress management. And it certainly is not only mindfulness of picking up a raspberry or a grape and eating it over 5 minutes. If your boss will notice that you are eating a raspberry for 5 minutes, then you will probably not have the best appraisal coming around, because they are expecting that you eat, talk, write your mails, talk to the client, do 50 other things while you are driving on a two-wheeler and do all of this put together. So that's our approach to modern day life. Since this is a bit of a business conversation also, the combined economic cost of mental health will reach $6 trillion a year by 2030. By 2019, 12 billion working days were lost only to depression and anxiety. So which perspective do you prefer? If you are from the finance side, do something about mental health because you're using productivity. If you are from the HR side, H stands for human. Bring the human out of you, start focusing on the mental health component. If you're a healthcare practitioner, you may be a cardiologist, you may be the most famous Dr. Guleria, my friend Vinayak out there. You can be anybody. Try doing a consult without a little bit of psychological component in it. It's not going to happen. Whether it's a surgical intervention or a preventive intervention or a community intervention, try doing it without mental health. It won't happen. And that's where the challenge is. I don't subscribe to a utopian world. We surely aren't going to have one ever. We need to see practically what is possible, and that has to be the way forward for us. What is the reality? Reality is that mental health concerns are rampant. No point debating it. 1 in every 6 years lost to disability are because of mental health. WHO says in 2022 report, depression and anxiety alone increased by 25%. Fact of life, no point debating it. If there are about 10 odd people per row, I'm sorry, 3+ of you will have a mental health issue. like it or not, statistics, none of us can find it. There are 5 people sitting on the dais. I have ADHD. It fulfills the criteria of at least 1 person out of 5 having a mental ailment. That's mine. So at least the remaining 4 are statistically safe. Fact of life. Second aspect, we have a significant shortage of mental health professionals in our country. Again, there's no point waiting for the day. It's not going to happen in my lifetime where our ratio is going to be like some of the developed countries. The ratio of a mental health professional ranges between 70 to lakh to 1 in lakh. We are in the 1 in 2 in lakh people. So what is the solution? Your solution is not refer a patient to the psychiatrist. I'm going to be the last person to ask you to send me patients. Please, I can't see more patients. In any case, my mom believes one fine day I'll reach home like how she always believed for the past several years with all the films that she has seen over the years, that one fine day I will come home, kind of, you expect how a psychiatrist to be. It takes a lot of effort to a psychiatrist to look like this, by the way. I may not look like this in my chamber, certainly not by the second part of my day, because second part of the day you might not be able to know which side am I sitting. It kind of gets confusing. Reality is we don't have experts. So you now look at an example from what we've reasonably better done with one more population, one more subgroup of our society, which is schools, and pick up what we've done in schools. Decades back, a decade and a half back, we made school counseling compulsory, right? We all know counselors are compulsory in schools, right? I'll give you a math question. Simple question to you. Are the number of schools in India more or number of counselors more? So if you are making counselors compulsory in schools, but there aren't enough counselors, the math is wrong. Right? Even if you will put a counselor in a school for about 2,000-3,000 kids, I mean, come on. And even if they are there, they are still ending up taking some, everything except typically, which is psychology, more often than not. But we started at a place. We started with that. What did that do? More parents became aware. More teachers became aware. We learned as a society. Then we got into teacher training. We got into soft skills, which HR and training likes to use, but life skills when it comes to kids. We understood bullying needs to be addressed. Today we understand media literacy needs to be done. Today we are talking about a mental health curriculum for schools. There isn't a choice. Your best case scenario is you have kids for about 10 years in your school. You train them right from year 1. They become more mental health aware. They know when to seek help. They know preventive approaches. Their lifestyle is better. They know coping skills. Their social communication skills are better. They are not stigmatized, don't have discrimination, they don't bully. They deal with the media better. You are going to reduce the kind of burden of mental health that's going to happen, let's say, 2 decades down. That's what we are doing, and I think we're doing a reasonable job as a country, given all the deficits that we've had, and we continue to do that. For me, one of the highlights, if you ask me, in the last decade has been 2 things. Pariksha pe charcha that our Prime Minister does, absolutely brilliant. The Prime Minister talking about and telling kids to, take a break. Is an important message in a country where children are told, don't take a break. At the same time, when last year in our finance budget, when Honorable Finance Minister talked about the word mental health, when I passed out in 2000, I would have not thought anybody is even willing to talk the word mental health. Schizophrenia, depression तो बहुत दूर की बात हो गई, mental health word से डर लगता था हमको. पता नहीं बोल देंगे तो हमें ना हो जाए. From there, we've come down to the fact that we realize that mental health needs to be addressed. It's sad we needed COVID to do it. It's sad. But yes, COVID brought conversations. Today you have a conversation happening on well-being and you have a mental health expert speaking. That in itself is way forward. In 2 decades back, nobody would have cared to hear about a mental health professional. So what can we do should be our question. In my opinion, picking up from what the government is doing, the solution of mental health for India lies in digital health. Like it or not, that is the only solution we have. Is it perfect? I know there are lots of critiques of telehealth per se. I am not one of them. I believe telemental health is the only solution for our country. Let's not beat around the bush. When you don't have experts, and when your experts are divided very unequally, largely towards the metros, so much less towards their outreach, what is your solution? Digital health. I tell you my personal experience. The moment, by the way, I'm still doing just about 20% or less of my work in the physical space. I'm still continuously doing 80% purely digital. And I tell you why. What I realized was that the percentage of my patients who were coming from tier 3, tier 4 and village sector drastically increased in the last 3 years. I am quite happy with the urban metro people not coming to me. I'm happy they have enough psychiatrists and psychologists available in their cities, Delhi, Mumbai, Kolkata, name it. You have somebody sitting probably every 100 meters. But where you don't have a psychiatrist for a few hundred miles, for them it makes a difference. And it's something as simple as a video call over one of the social media platforms. Or an app if you have one, whatever way you prefer. And again, let's accept my branch is not a branch where you typically need to physically evaluate all patients. Yes, few would. Those you can always ask to come or go to the nearby place. But a large part of intervention can happen, one. Second, the psychological component absolutely does not require physical evaluation. As a psychiatrist, I may still require a few medical needs, but my colleagues in psychology, they don't. So psychotherapy becomes affordable, accessible, press of a button. And that's where the solution for workplace in India comes. My humble question, or my push for everyone, you have your P&Ls. There's something called EBITDA also. People like me who worked all our life in corporate healthcare, EBITDA keeps coming to us. I've heard the word a lot. I've never understood how to do the math. But then I became a medical professional because I couldn't do the math. In fact, that was one of the driving forces of my life. I don't want to do maths, don't want to do physics, don't want to do chemistry, बचा क्या? हमारे ज़माने में तो एक ही सब्जेक्ट बचा तो बायो तो वो कर लिया. How about looking at mental health outcomes per year in your organization? Did you lose work days to mental health issues? Did you have burnout? Did you have attrition? Did you have client interface being affected because of mental health issues? How many people are using painkillers or sedatives to manage and cope up? How many people have had outbursts or behavioral pattern changes? Has substance abuse gone up in the system? So on and so forth. You bring mental health outcomes as an approach. And I believe organizations need to bring in funding for mental health. Let's be very clear about that. I'm glad with the push that the insurance sector has got over the last 2 years. I still feel we just need one more big push and we'll be there where we should be, at least when it comes to inpatient care in mental health. I do feel it needs to come in OPD and rehab because it's chronic care after all. But how about, as all of you guys start in your organization workplace mental health solutions, and when I say mental health solutions, please do not restrict it to those webinars where you can keep your camera off, which probably is the most unpolite thing I have seen anyone do to anyone else, where a speaker is on the webinar on a cam and everybody else's cameras are off. I think it's an embarrassment. If I was a speaker, I would just stop speaking and say, okay, my camera is also off. Now listen. What you do is, you bring workplace mental health, and when I say mental health, I am talking clinical here. I am not talking some build social skills, build communication skills. That's happening in any case. Most HR and training programs are focused on stress coping skills, social communication, transition management, resilience, resistance, mindfulness. All of these Instagrammy words have become way too famous. If your HR is not doing it, then some influencer who like to call themselves influencer, I hate the word again, but are doing it on Instagram in any case. And most of us are scrolling Instagram and wasting our time, so might as well get some information which is sensible. Your solution is, you bring clinical intervention there, which means screening, By education. So you educate people on how to identify mental ailments, step 1. Step 2, provide access to a resource that you feel is credible. So that irrespective of the layer of your organization and where the individual is working, that individual is able to reach out for help. And now you as an organization pay for it. That has to be the key. All these 3 angles need to be done, and these need to be done by a healthcare provider, not by some mumbo-jumbo life coach. Right? Most of you here are from the medical field. So you look for that qualification, you look for the credibility, and you look for evidence-based intervention. And then you measure in a 5-year span what have you done. Workplace mental health has to have a clinical approach. And also one more thing. I have realized there are so many workplace mental health well-being platforms and all who talk about these unlimited consults and things like that. Data reports that even for more than 500 people, if it's the smallest organization, who would be provided for a 1-year consult or something like that, not even 3 or 4 end up taking it, which means there's something amiss. One thing is amiss is that some of them are not clinicians. Second is amiss, you are not focusing on education on who to go to, why to go to, when to go to, and interventions which also do not have medical intervention cannot be there. Because if you pick up 100 people who have psychological morbidity, you will be requiring medical intervention, pharmaceutical medical intervention in about 50-60% or more. And this is something that we need to think about. So my very simple brief is, there is an elephant, we don't address it. Addressing starts by your own self. You've talked about vaccines and how they help. Of course they help. Standing here with a booster, and if Dr. Goleria will tell me to take the 4th one, I will right now take one also. Simple as that. Fundamentally believe in it. Why? Because it's coming from a credible resource. It's coming from evidence-based testing. I trust what has been told to me. Now you bring that trust, you bring that science, you bring the advances of mental health, bring it to your organization. So what do you do now? You go back and we meet again next year and I repeat the same thing because nothing will change. I've been saying the same talk for the past 20 years, only the numbers are changing. What was 1 billion effect in 2019 to a 1 trillion effect is going to be $6 trillion effect. That's the only thing which is changing. Number of people struggling are increasing, damage is increasing, people are struggling, and a newer and younger generation is living with in an environment which is not mental health friendly. Thank you.